interesting times, certainly, to be working around privacy law and the internet in the time of COVID-19. And I've been working since really April, I guess, on issues to do particularly with data-driven technologies and COVID-19. I became involved in looking, as I'll show you on a later slide, at whether legal safeguards were needed. Okay, sorry. Maybe if I put it on slideshow. Does that work? Yeah, I've just been told in chat that I was too small. Yeah, I've been looking since April at issues to do with the law and ethics regulating, particularly contact tracing apps, which some of you may know were a very sore point in the UK, or more specifically England and Wales, where I live. So this has led over the last 6-7 months to, it's trying to do its own thing, to a project that I'm now kicking off with a variety of interesting people, including the Bingham Centre for the Rule of Law, the British Institute for International and Comparative Law, Edinburgh University, the Alan Turing Institute, and my own. And given all that, it's only lasted 9 months, which is going to try and look at good governance and the rule of law in relation to data-driven interventions, including technologies, in pandemic emergencies. So we're going to look at ethics, at international public law, at human rights, and I'm going to try and look with my associates at the data-driven parts of the technologies, really, which takes you into privacy and data protection and other aspects. So particularly here, I'm really giving an outline of some of the sort of highlights, really. I think a lot of the public attention has focused on the legal issues around two technologies. One I've already mentioned, which is state national contact tracing apps. The second, which has really come into prominence in the last week or so, which is why I kind of pivoted this talk in that direction, is vaccination passports. Because now that we have a vaccine, are we going to start carrying around vaccination passports? Are they going to be needed to get us onto a plane, to let us leave the country, to go through an airport, to go to our workplace, to enter a hospital or a surgery? You know, so many issues that are waiting to happen. So I think this is a very, very kind of proximate inquiry right now. We did look at immunity passports, which are related, again, right back in March, April, and I'll come to that. But while I haven't got time to talk about it in this talk, I do think it's worth mentioning that some of the data-driven technologies and interventions into emergencies are not going to be these ones that kind of grab you by the throat because they personally, we can imagine them affecting our own privacy, our own freedom of movement, our own access to challenge, you know, what seem like unreasonable restrictions, but will affect aggregate groups or populations. So to take a UK example that is, again, very, very controversial right now, data that is collected in various ways, rates of infections, number of infections per 100,000, number of people being admitted to local hospitals, rate at which these rates are going up or down, are being used in the UK and probably most countries to assess what tier or level certain areas of the country get put into, which then affects whether the shops are open, whether the pubs are open, whether you're allowed to travel, whether you're allowed to go to another area, and so forth. And all of these have disparate effects on various groups, the poorer, the socioeconomically deprived, perhaps minority groups that may be more prone to infection, etc., etc. So these aggregate or group effects are also driven by the data during these pandemic emergencies. This is a strongly techno-driven area. And I think we need to also start thinking very hard about what regulation or governance is needed to keep these fair, to keep these right, to keep these non-invasive of basic human rights, and whether our current laws are adequate to deal with these aggregate or group interventions, as well as these individual personalized interventions. So going on to the next slide, which I hope is catching up with you, not too much lag. Briefly, looking in a way, another useful thing I hope I'm doing in the project is looking at contact tracing apps as to some extent a worked example in the past. It's not that we're not still using them, but we have had some idea of what kind of legal and ethical controversies and political controversies there have been around them and how well the laws cope with them. And then I want to come on to look at vaccination passports as to some extent a future technology, because even though vaccines are now here, not even on the horizon, I can say here, Scotland launched it yesterday, haven't really got into the legal problems around it yet. So starting with contact tracing, I think it's quite well known, probably quite a lot of people in the audience and on the panel, that this sparked really a global debate around privacy. It was often labeled as privacy. I would suggest it was probably more of a debate around trust in many ways. And do you trust your government? Do you trust your police? Do you trust your private sector? So some of the issues that were dealt with here included, like, what kind of data should we be collecting? If the purpose of a contact tracing app is to make connections between someone who has tested as infected or is deemed to be infected and people that they have been near, for example, within 2 meters for more than 15 minutes in the last week, which is often the common metric, then how should we try to establish that? And so a first debate there was between, should we collect location data from things like phones or even possibly smart lanyards or Wi-Fi networks, or should we stick to a technology like Bluetooth, which is less likely to create a surveillance network of where you have been at any moment, which most people find a bit worrying, at least in Western democracies, but is probably less accurate in some ways at establishing that proximity. So, for example, it was found in the English example where I was involved in the ethics committee for the first version of the app, that there were many claims that Bluetooth was insufficiently accurate because, for example, it will say you're near somebody when there's a very flimsy wall or partition in between. It may say you're not near somebody if you're on a bus, say, and the bus has got a big metal, bulwark. Then the signals may bounce off it and it may look like you're not near or you're not near enough or whatever, or not near for long enough. So there were a lot of issues about Bluetooth. This led to more issues, at least in the English example and probably elsewhere, about what other data you might need to collect to contextualize a finding of proximity. So, for example, some evidence showed that people were more likely to accept the warning to isolate if they had more information about where it came from. Where was I? Who was I near? Why was I near that person for 15 minutes, right? Mostly this kind of data there's a trade-off between giving you this kind of data and giving you better privacy protection, as we've seen in most of the later contact tracing apps, right? And there's also an argument that you should collect as much data as possible to try and build more of the kind of profiles I was talking about, to try and extend your epidemiology. And again, these arguments were made very strongly in the first kind of iteration of the England and Wales app that never went into production. There's also issues about how do you use this data? Do you just use it for contact tracing? Do you use it to try and establish places as well as people that might be risky or dangerous? And if you do, again, how accurate is that? Does it justify closing these sites down? There might be restaurants or pubs that then lose all their business. Should we be keeping all this data in non-anonymized form or anonymized form for medical research? Should we be keeping it for after the emergency to try and inform future health policy? And there's another big debate going on there. In Asian countries, there's already been, in some, China, there's already been some indications that they quite like to keep all this data for what's sometimes called, rather worryingly, programming populations, deciding what health interventions, what nudges might be useful to create a more healthy population in future, perhaps one that moves more, eats better, goes swimming twice a week, etc., etc. And then we've got a final couple of real worries, which are, if we collect this data, who can we share it with? Given a tendency in many countries, including my own, to work in public-private partnerships nowadays. So a big debate in the UK has been, how far can this data be shared out to the private sector so that they can do data mining and follow up and test and trace and so forth? Can they keep that data after the emergency? Can they keep that data to improve their own algorithms for their other customers that they may have, who may not be the state? And how long, fundamentally, how long should we keep this data for? Should we dismantle this entire surveillance apparatus, or could be surveillance apparatus, at the end of the emergency? Should we throw away the data after 28 days, which, was deemed to be the kind of average length of the period of infection? So all of these questions, which were debated really a lot around about sort of March, April, May, very much were headed off. The debate crystallized very much because of the intervention of a European consortium called DP3T, and because that was then the protocol that they developed was then very much taken up and extended by Google and Apple in the Google Apple Emission Notifications System, or GAEN. We developed a new set of privacy preserving apps that were decentralized rather than centralized, in the sense that the data that was collected about the proximity and the parties involved was only kept on people's phones, essentially, and was not shared to governments in a centralized way. Now, that's a huge generalization, but I haven't got time to go into it, but that's the broad outline. That system took off across Europe and to some extent globally, and is now what you find in, I understand, the German app, the Italian app, the Belgian app, the UK's various apps, because we have different regions and so forth. Now, one of the points I think that's really interesting and paradoxical about all this is you can argue that's a win for privacy. You can say that that means that even in a pandemic emergency, people don't trust their government. They're worried about future surveillance infrastructures, and they would rather, strike some balance between preserving their privacy and still providing a way of contact tracing. Yeah, and that's what that system gave you, which is great. But I think what is also apparent is that the end win was really for efficiency and to some extent convenience, and only partly or arguably not at all really for privacy or trust. Because the net effect of the Google Apple protocol, because of the way that particularly Apple built their phones and their systems and their APIs, was that simply the other types of apps, such as the centralized one that France was developing, that England was developing, would not really work on Apple iPhones especially. I think we found that it was working on only 4% of iPhones, which is a silly figure that almost no one believes. But it gives you some idea of how bad the accuracy was with using a centralized app. So has that ended up as a win for privacy? That's a really big argument, I think, for political economists as well. Does it mean that we trust Google and Apple more than our governments? I'm not sure. Does it mean that we'd like to be able to use our iPhones and them work? Definitely. Does it mean that we're happier with sharing that kind of data, but we're still unhappy with sharing the kind of data we talked about in the last talk, data that may go into targeted advertising with Google and Apple? It raises all kinds of really paradoxical questions. And in the end, the take-up of contact tracing apps generally has still been quite low, despite, vain efforts by most countries. So I think, although this may be slightly out of date, the average uptake in most countries has not been much more than 30% max, and even that is quite good. And that brings us to a whole set of other questions that I'll go into over the page. I can't see my timer anymore. I don't know how much, oops, oh my God, is that me out of time? Let me just say a couple of minutes about vaccination passports. So I just want to mention this is the upcoming. So you might say that this is a less controversial technology than contact tracing apps, because, we all want out of this nightmare we've been living in for 10 months. Is it not a good thing that people who've been vaccinated might be able to carry it around so they can get on a plane or a train or into a football stadium and not infect other people? That's how most people think, I think. But there is still the issue that this may lead to the creation of a new form of digital ID, really a digital identity database that can be disguised or passed off partly under the mantle of a health ID. Now, again, trying not to be alarmist, because that's really not the kind of academic I am, what are the pros and cons of this, right? If you compare it to immunity passports, and I'm going down to my second para here, you might say that vaccination passports are more scientifically valid. We know that vaccinations work. we know that someone's had it. And that's a picture up there of the kind of card that someone might be given out, you know, just a card, like a yellow fever vaccination paper, not necessarily even a database. On the other hand, there are issues with them as well. There are going to be multiple vaccines. Some may be more or less effective. Are we going to recognize a Russian vaccination like a UK or an American or a Spanish vaccination? Do we know that the duration of them, and so forth? But the key point that I really want to bring in while I've still got some time is that although the use of them may seem tremendously helpful for society, it can still have enormous worries for discriminatory use. Okay, so I come back to this point that how far should we allow the use of these, particularly by the private sector, which is what really worries me, particularly by the gig economy, particularly by private businesses, private shopping malls, private sports stadiums, to use these to restrict entry and also to track you. So you're talking about freedom of movement, freedom of association, freedom of speech, privacy, and perhaps also due process, because, you know, how are you going to challenge these kind of restrictions or exclusions? Now, if it's the state, although you may say it's bad that the state creates a surveillance and infrastructure and restricts your freedoms, at least there are ways of challenging the states, you know, within human rights, within freedom of information, within, in my country, judicial review, administrative law, and so forth. But when you start to move into the private sector, it's quite easy for the state to defer and avoid responsibility. And this is what I see happening. The last thing I'll say about just the last couple of days is that after saber rattling from the UK for a very long time that they were really interested in immunity passports and they were really interested in vaccination passports, suddenly a couple of days ago, we have Michael Gove, our minister, God bless him, saying, no, we have no intention of creating a new digital ID. We have no intention of using vaccination passports on a database. That's just an appointment card. Now, why is he doing that? I think it's because he knows that there is a private sector infrastructure out there of digital ID suppliers, Yoti, Common Pass, Block, millions of them, that are desperate to get in on this scene and make money. Now, what will their responsibilities be? How easy will it be to challenge them? How far will they share data to people like the targeted advertising people? How far can we control this? I skipped over data protection. Data protection clearly has much to say here, but data protection may also not be adequate. And in terms of discrimination, you're not really talking about data protection. You're talking about equalities law, and that has huge problems too, because equalities law largely works on the basis of, are you discriminated against on the basis of a protected characteristic? And health, particularly COVID status, is not a protected characteristic. Disability is, but health itself is not. So equality law is really going to need looked at as well. So the last thing I'll say, because some people are in the audience, is there are ways that we might deal with this. One is technological, and I see we have John Crowcroft in the audience, who's been very big in working on cryptographic kinds of immunity passports that might say, I'm immune, I'm vaccinated, without giving away more about you, without giving away your name or perhaps your race or your address or your email address or any of these things. Other people, such as the Ada Lovelace, have said we need more prior precautions. We need more the equivalent of data protection impact assessments when these private companies come into this world, as well as the state, to see that they are taking account of things like discrimination, racial minorities, privacy, and so forth. And what I think is we're going to need either some real attention to data protection, equality law, statutory guidance, human rights, and we need to look to make sure these interventions are necessary, proportionate, legitimate, and subject to challenge.